your achievement. So we are a nonprofit that works in Palm Beach County, and our mission is to make sure that high school students like yourselves, once you graduate, you are ready for the real world. So I know you guys are participating in the medical academy right now. So we brought you a speaker from the medical industry. She's going to talk about her journey. She's going to talk about kind of what brought her into the field, maybe some challenges she faced along the way, and she's just going to impart her wisdom on you guys today. So pay attention and let's give a nice warm welcome to you.
Thank you guys. Let's just make this very, conversational. You can jump in and interrupt me. That's fine. I'm accustomed to distraction. I have 2 children, a 4 and a 2-year-old, and I'm constantly distracted all day long. So don't worry about that. So I hope today that I can lend you perspective and through my medical professional journey to help your medical professional journey. My name is Roshini Singh. I'm a nationally board certified family nurse practitioner. I've been in the field for about 14 years. I practice family medicine. I'm not in a specialty track. I just love family medicine because I get to see the patient as a whole, knowing everything about them, from all their acute conditions, their chronic conditions. So really, I like being that first person a patient comes to discuss their health concerns and help them to practice preventative medicine and preventative health. I am from New Jersey and then moved back home to where my parents were from in Guyana in South America. It's the only English speaking country in South America. Is anyone here from South America? Yes? Oh, what part?
Cool.
Colombia? Okay, so you might know that there's one English speaking country there, and that's at the top.
Yeah.
It used to be called British Guyana, but then it was ruled by British. So I wish I spoke another language, but we're completely English. So that's where I'm from. And just to go on with my professional journey now, my schooling, I did my Bachelor's of Science degree at Nova Southeastern University. And I wrote for my registered nurse licensure in 2010. So I stopped for that. I went on and I practiced on a telemetry unit, meaning like a cardiac floor. So patients with multiple cardiac conditions and multiple other issues. So it was a really good learning experience. While I was a registered nurse, I went back to become a nurse practitioner. So that's a master's degree, and I did that at Florida Atlantic University. I graduated in 2014, and then I sat for my board licensure around that year. Total all schooling from, bachelor's was about 5 years or so for me particularly, and then the master's was about maybe 2.5 to 3 years. So that was the length of time, but I was working as an RN while I was going back. At FAU Go Owls, I did my hat. So yeah, it's the mascot is an owl. You guys are a bulldog. I don't know why you guys are a bulldog. I don't know. Can someone share why? No one knows why. Okay. I was just curious. But anyway, we're owls, and this is decorated, looking very Indian because obviously my background is Indian, but I grew up in South America. So right, nationally board certified family nurse practitioner. While I was in my master's, I did 2 mission trips. So when you're in certain programs, they allow you to give you opportunity to do cool stuff. So I went to Guatemala twice, and we did cervical cancer screenings on indigent women. And was it a very eye-opening experience for these poor women that didn't have access? Cervical cancer screenings, pap smears, that is. So that was wonderful, and I did that twice. Right now, back in school again for my doctorate of nursing. God in heaven knows why I'm back in school with the 2 children and the business. I'll explain that. But it's called a DNP, a Doctor of Nursing Practice. I'll be done next year, January. I have a doctoral proposal to put forward to be published. And hopefully, we get this on a political level and it makes changes for our healthcare system. But it's about screening patients for cognitive issues earlier on, because there's an issue with primary care providers having the time to do that. Alzheimer's is very common. Each of you may know someone with Alzheimer's or a type of dementia, whether it's your grandparents or your friend's grandparents. So it's a very common disease. So my doctoral project is about screening for it earlier so we can get that patient earlier resources, earlier treatment for better health outcomes and better quality of life. So that will be done next year. All right, so moving along, roadblocks. How to add some humility to this whole thing, listen, I was fired from job positions 2 times. I'm very rebellious when it comes to the healthcare and the management of it. There's something that I wasn't very good at. This is my humility moment. But that made me realize that like, I don't want to practice in the traditional primary care format or the traditional family medicine format. I wanted to do this in my own style. So I am the founder and CEO of a mobile family medicine practice. It's called a direct primary care model. It's a specific type of medical model, and we opened it in the year 2021. And what it is, it's providing increased access for patients. They get quicker appointments. We spend a longer time with them. We strongly believe if we spend a longer time with patients, really getting to know them, their family, all the way to their medical conditions, everything, we can diagnose better. We can give them proper treatment and the resources because we fully know them. So that's what the model is about. And we're completely mobile. So we drive to the patient's house, and like how you or your parents may go in for their primary care consults in office. Okay, it's the opposite. We're coming to you basically. So it provides a very convenient pool style. And patients text us all day long. Like I have one patient texting me right now for like a UTI. Like, you know, they're like, I'm always like, they're texting about symptoms and we're responding back to them. So that I opened that business in 2021. So we've been about a little over 3 years in business, and it's flourishing. It's doing really well. So things that I learned from this whole journey, you know, fired, open a business, in school, this long journey of like 14 years now altogether. I learned that you must be passionate about what you do. Society deserves that. You know, really, really like let that sink in. Society deserves for you to be passionate about what you want to do. I learned that it is okay to make mistakes, obviously. Once you put aside your egos and own up to it and make those changes. I learned that strategic patience is important. For example, giving my business 3 years to flourish, you cannot expect to do something and that you'll have the high turnover, you'll make all this money. I could say only now in January, finally returning some sort of a profit, to be quite proud with you. Prior to that, wasn't really earning anything for myself and my family. So it takes time. And I know that the business decisions that you would have made will flourish as time goes on. I learned that always doing good work and staying ethical in what you do will provide a healthy reputation. And because we practice that, we have a healthy reputation. The community patients do utilize our practice. I learned that networking with the right people and placing yourself in certain circles of like-minded individuals is key to the growth, particularly for my business, but the growth of you. There is this book that I have in my doctorate. It's called Emotional Intelligence. I'm going to pull up the AI definition of emotional intelligence so I don't butcher this. But emotional intelligence is the ability to understand, use, and manage your own emotions in positive ways to relieve stress, communicate effectively, empathize with others, overcome challenges, and diffuse conflict. All of that sounds so familiar, right? Every human being should practice this, right? So our world needs a little bit of step up and elevation in who we are. It's not just about getting the degree and taking the job and earning money. It's more than that. And this is called EQ. And I encourage you to learn about what EQ is. You will be successful if you understand this. And anyone of any age, once they understand emotions and stuff, can practice that. What else did I learn? Okay. Lastly, I learned that the balance of life is most important. And it's all possible with a planner. I know you guys like, do you guys use a planner? Do you guys like take a book out? Or that all like or something. But like I use my phone actually, but the planner and writing it down is very good. Sometimes it feels better when you write it down and it's out of your head. You've written it down. You've scheduled something for the next week. It's possible if you strategically plan properly. If you really want something, you can carve out the time and make it happen. How many times do we hear that like, I don't have time for this, I don't have time for that, I forgot, oh, I should have gotten back to you. I think it's all nonsense. If you really want to make something happen, then you would have done it. You would have made that time. Make it a priority. Keep your life balanced. Exercise, eat well, spend time with loved ones, educate yourself. It's everything in one that will make you very successful in your life. How can you get started? Well, a general rule of thumb is think about realistic. The key word, realistic goals over the next 1 to 2 years. Write it down. Put it out into the universe. Because if you put it out into the universe, you talk to people about your goals, you never know. Opportunities will come up. You'll have genuine, authentic conversations with people. They will lend you advice. It will be back and forth. We need to learn to effectively communicate. Learning to effectively communicate will get us to where we need to be. Show your authentic self. I guarantee you, if you practice this with EQ and putting your thoughts of your goals and your dreams out in the universe, it will open up those doors to get your professional journey started. And that's all I have for now. But yeah, so I don't know if there's any further questions, but oh, our practice, by the way, was voted the best in 2024. And yeah. But it's really like I told a bunch of patients, I'm like, you could vote for me. Like, so that's really what happened. I told all my patients, I'm like, please vote for us. And like a lot of people voted for us. And we got this designation award for 2024 being one of the best medical practices. There's many other wonderful medical practices out there. I just, so it was just nice to have this, and we're very proud of it. So I'll stop there. What questions do you guys have? Come at me.
I have a question while they
Yes,
think.
please.
So I know COVID, your business, it sounds like you started in 2021, and that was just post-COVID or still kind of in the mix of COVID. And COVID was so challenging for so many businesses.
Yes.
How did it affect your business?
Oh my gosh, it didn't, because patients like the idea of us coming to their house. A lot of patients stopped going to their primary care's office because it was in an office and they were worried that other people sitting next to them may have a virus or something. There were some people that they're super fearful about going out at the time. So our business thrived very well because patients were like, oh, good, you come to me into my home. So it had zero effect on the business. Yeah, that's a good question. Yes.
So when you graduated and you were looking for a job in your profession, how long did it take for you to actually get a job?
Okay, how long did it take for me to actually get a job? Well, when you're in a medical professional track in school, usually you have to do clinical hours. So you end up meeting a lot of different medical professionals while you're finished doing school. So I met a lot of registered nurses, physicians, other NPs while I was in school because I had to complete clinical hours. And because of conversations and emotional intelligence, and it's still a practice, and talking to people, they had ended up, people had ended up liking me along the journey. So I reached out to my contacts and I say, hey, I'm done now. Can you hire me? And that's what happened. A lot of times you'll find your next steps in your journey through people that and that you had good conversations with. So that's why it's so important, to do that. It's you can find the jobs on Indeed and ZipRecruiter. You can, right? Might take you a little longer, could be a little challenge, but if you have a network and people and you're putting yourself out there, much easier. Yes.
There's a question from the online audience about your clinical rotations. What type of clinical rotations did you do, and what was your favorite and why?
Oh, good question. So in RN school, it was a mixture of multiple things: obstetrics, pediatrics, general medicine. To me, I've always been drawn to just general medicine, family practice. And then when I went into NP school, my board certification is in family practice. So mostly the whole program was in family medicine. That means knowing the patient and every condition that they have. It's cool because you get to really learn. I don't know everything. I mean, patients come with new conditions all the time that I don't know about, that I have to research, figure out, determine if I can take care of it or refer them to specialists. So I love family practice because I get to touch every part of someone's health. So that was my favorite. Yeah. Oh, yes.
Hi. So I know you said within your business you went to people's houses.
Yes.
But have you ever incorporated televisits as well?
Yes, it's such a good question. So yeah, we're mobile and we go to the patient's homes, and then in between that, we do video calls. I have an app that patients download before they enter the practice. And if we have to jump on video, jump on video. Let me see you. Let me see what's going on. We learned with the pandemic. The pandemic has taught us a lot of things. to do things out of the box and get rid of some traditions. So we realized like, wow, through telemedicine, we can actually treat things really effectively. And, you know, so that got implemented more. If you guys notice, if you go to your doctor's office, your practitioner's office, they're like, oh, do you want a telemedicine visit? It's becoming more popular. But I truly believe still, I'm a little old fashioned, you know, seeing patients in person is completely different. You get more information, you get to really eyeball what's going on. I can listen to their heart. I can more show my empathy and emotional intelligence to a patient in person. I do like telemedicine, but if it comes to it that like months have passed by, I'm like, I'm going to come see you. I want to see you. To keep that connection. You can't keep strong connections with just virtual. Not possible. It's just not. So highly emphasize that. Yeah.
And a follow-up question.
Yeah.
Yeah, please.
So during televisits, is there any way to examine your patient, or would you have to come physically see them?
So some diagnosis, like let's say the patient had a UTI, a urinary tract infection, like a fungal vaginal issue. Many diagnoses can be heard by symptoms, and we have the experience, right? We've been in practice for so long. We hear the symptoms on video. We're like, we know what that is. We've treated this so many times. We understand this. So a lot of times I don't really need to do a full examination for certain things. Certain things, yes. Let's say the patient is having like some wheezing and maybe they have a history of heart disease and different things. I'm like, you know what, this is a little, or they're an older patient and I'm worried about pneumonia. Then I'm gonna say, you know what, I wanna come out and see you to listen to your heart and lungs and diagnose this properly. So that depends, you know.
You said you owned your own business. Can you talk about what the hardest part about owning your own business is? And did you have to take any classes to own your business?
Oh gosh, owning your own business, the hardest part for me is the business side, because when you go through, whether it's medical school, nursing school, NP school, PA school, you're not learning about business. You don't learn about finances and how to put together a business. This was just all thrown together by me in the beginning. And I made a lot of mistakes, and I learned from them, and I changed. I'm still adjusting the business right now. So yeah, the hardest part is the business part, marketing and finances. I have an accountant, taxes. Oh, that stuff is just, the medical part is like the easy part. I enjoy it, but the business part is the hard part. Yeah.
Can I piggyback off of that?
Of course.
Okay, so one of the things you're giving your patients basically full access to.
Yes.
We talk a lot about mental health and work-life balance in our classes.
Yes.
How do you walk that line when still trying to be the practitioner that you want to be and believe in, but still making time for your children and still making time for yourself and being able to shut down the practice to take care of yourself?
Oh gosh, that's a daily problem. So like that was one of the things I said at the end. One of the things I learned, balance of life is the most important thing. And the only way I can somewhat function with a 4-year-old and 2-year-old, married, my own home, a business, doctorate degree. I do voluntary work for women's in distress, abused women. So we do see those patients. There's so much happening, is by that planner. Guys, this planner will save your life. That I'll like put out, like, this is the time I'm doing this. Strategically, I tell my staff, like, cut, like, there's no calls. If there's an emergency, I will pick up. Like if it's after 8 and a patient needs something and it's urgent, I'll pick up. But if it's something like a medication refill or something that I know that can wait for the next day, then I leave it to wait for the next day. It's not perfect though. I mean, it's not. Sometimes I'm speaking to a patient at 7 when we're having dinner, and it's hard. It's really, really hard. But it's a daily practice. You always have every day to improve, guys. So if one day it didn't go well, the next day you're going to say, I'm going to do this different. I don't want this. So yeah, it's hard. Yeah.
Another follow-up.
Yes. Oh, I love that. Thank you.
I picked up on you talking a lot about women's health and more about like women's reproductive system, like a reproductive system. I know you said you're a family doctor, but do you focus a lot on women's health as well, like specifically?
Yes. Yeah. Family nurse practitioner. And yes, we do touch that part of women. You know, I do provide pap smear cervical, which are cervical cancer screenings. We talk to women about a big thing with my practice, even though we're family medicine. I talk to young girls and women about appropriate birth control and how important that is. and to prevent yourself from, you know what, and like to be responsible about it. So that's like a big counsel and teaching point in our practice. So I touched that. Pap smear screenings for control. Women of certain ages, we do breast cancer screening. So we'll send them, let's say, for a mammogram. If they have a family history, we might send them earlier than the recommended age. So I am touching that part. Or if a woman is interested in getting pregnant, I'll counsel them through what healthy habits should they be on, or what prenatal should they be doing to get them prepped. But at the end of the day, then I safely put them off to like obstetrician, obviously at UN. And we managed our healthcare in the background for anything else. Good question. Yes.
So like to not touch on the medical side, but on the insurance side, because
Yes.
some families struggle with insurance. Are you like do most insurance cover you, or do you have to like find a way to work with your patients on some of these aspects?
Oh gosh, that's a good question too. Okay, so I didn't touch on that. So the practice it's a Netflix subscription, guys. So it's like you pay a monthly subscription to us. It's an affordable rate. We're supposed to be concierge medicine for the masses. I'm not concierge medicine for only high affluent people, but like they pay us a monthly rate. It's like it ranges 100 to 130 a month to have this very cool access where we drive to you, text. You have efficient access. I couldn't take insurance for what I do. Insurance, the third party insurance can't pay me for what I do. They wouldn't understand or reimburse me appropriately. So these models, we have to become very creative. We're like, take insurance out. You, the patient, are going to pay me directly for my care. That's how it was before insurance came about. When insurance, the third party came in the room, the gorilla in the room, we call it. I'm here, the patient is here, but we have this gorilla here. It affects our decisions because insurance pushes us to make certain decisions, or we have less time with the patient because insurance is involved. So this model takes them out. You and I, we talk. We still utilize insurance. Insurance is very important for like catastrophe, fracture, you were in an accident, chest pain, you need to go to the hospital. You need insurance still. But insurance does not equate to great quality healthcare. You could have an amazing plan, but you still don't get seen fast enough. You don't get the time with your provider. And that's what this model does. So we're good for people without insurance because let's say Obamacare or any of these plans, if you buy insurance, it could be, let's say $600 to $1,000. But at least a patient would pay us $120, right? To have a PCP access so they don't run into urgent care or the ER for a little high blood pressure. Don't go there. You come to your primary, let's take care of it, keep you out of the hospital, save healthcare dollars and costs. Right now, we're at a high deficit in healthcare costs. So our models are trying to save that, keep the patients out of the hospital, keep people healthier so that, our healthcare deficit won't continue to rise. Yeah, that answers the question. Yes.
Your monthly subscription.
Yes.
Do you have different levels of subscription? Not necessarily better care, but if they have a larger family.
Yes, yeah, of course. Depending on how many like family members come into the plan, I'm like, we're a small business, everything's a little negotiable. It's not like we're a big corp where it's like, it has to be a certain way. So if you come in with a lot of family members, we'll adjust and deduct. We have different plans if the patient comes in with like, let's say 10 or more chronic conditions that they're seeing 3 or more specialists. Primary care, we have to review the notes from each specialist. We have to be involved. What did the specialists do? What happened? What are we doing now? So it takes a lot of time on our part. If they're on 10 medications or more, right, it takes us more time. So our monthly membership might be a little higher because, to be compensated for staff, for myself to spend that additional time. Yeah, so that's your preference.
How many employees do you have?
Oh, right now I have, there's 3 independent contractor employees. So they're technically not like specifically hired under me, but I utilize companies to like do what they need to do, and they're 1099 employees or independent contractors. But my full W-2 employee, who's the office manager, she is our actual employee. So yeah, we're a small business. We're very boutique-y, so I don't need more than that right now, please. Yeah. Yeah. Anything else online?
Yeah. What kind of soft skills have helped you succeed in your job, not just with your staff, but with your patients?
Soft skills. I think to answer, I'm not sure exactly what you mean, but like caring for your staff and caring for your patients. I hope that answers it. If you care about your staff and their livelihood and like I care about my manager, she has 2 children, you have to be understanding and caring. If you're going to be a leader, you have to have empathy and understand where people are coming from. And, you know, if you don't have that, then you're a little bit of a dictator. You're just telling people that they must do this without checking in with them. So I think that's so important if you're going to be any type of leader. You must have care and compassion to people's lives. And that applies to the patients as well. We have that, I think everything will be okay. Yeah. Yeah. Yes.
So now that you like furthered your studies, you're a family doctor. Do you see yourself like noticing specific signs or symptoms on your family or even just people around you that you did before?
Oh my God. Yes. Yes, I know. Yes. I mean, I look around this room and I'll probably be like, oh yeah, what's going on? You become just very astute. Like you walk along anywhere and you're like, what's, you know, you see something. You could probably relate to this, like, you know, as a paramedic for 30 years. When you're in the medical field, you're automatically, you walk into a room and your assessment of life and people is so much different. And you hear so many bad things, unfortunately. People come to you in good times of their life to get preventative checks or the worst time of their life. You know, from the simplest things to a cancer diagnosis that we may have found in GP. And you know, you have to be, what am I saying?
When you walk into a room, you assess patients and you see them walking down the street. She said, she was asking whether or not you do that to your family as well.
Yes. Yes. Yes.
Do you have a favorite success story? While
Oh
you're
my
in practice
gosh.
or beforehand?
There's so many success stories because it's a lot of detail. I can tell you that there's so many patients that we've tremendously changed their lives by sitting there and listening to them and understanding where they're coming from and providing the appropriate treatment options that change their life for the better. They're better people in society. They're better parents. And to me, that's so transcending and beautiful that our impact in family medicine is so great. So that's why if you ever get into the family medicine field or any medical field, you've got to love what you do, because if you don't, your impact is not going to be great. You're not going to be good to society. You know, civilian, other patients and people are not going to thrive as well because we're not loving what we do. Yeah.
How do you see the tech and the tools that you use? How have they changed since you started? I know you've only started 2021, but you know, how have you seen those change? And do you have to take courses to keep up with that?
That's a good question. I should take a course in AI actually, because it's like becoming more apparent, of course. But like I utilize AI in like writing like maybe notes for like my medical notes. AI is somewhat used because a patient comes in with all their problems. We have to now type up a report after each patient. And I do hundreds and hundreds of visits. So like I've developed like serious carpal tunnel from typing there all day long. So AI has definitely been great in helping to get those notes going. We implement AI into like doing notes when patients are sick or like, you know, it can, but in that manner, I haven't stepped on AI in terms of treatment, although AI can give me guidelines for treatment and then I take it and individualize it to the patient. So, but I should take a course to learn more about it. There are courses. Yeah. Yes.
How do you market your business?
I have a PR agent that right now is telling me, and sure, you can take a ton of pictures and I got to do all these things and jump up and down, whatever. Like she wants me to do all sorts of things because like society demands like targeted marketing to what people look at now. Social media, it's Instagram, Reels, even though I don't like it, guys. I don't like it, but I don't have a choice. I got to jump on there and do my like talk and I hate it, but like it's so important to like marketing your practice now. So I have an Instagram account, 365 Wellness, a Facebook page. I have a PR agent. I attend business meetings. Oh, you know, the biggest part about marketing is relationships. Out there in networking groups, talking, getting to know people, biggest part of marketing, people getting to know you and your business. And they like you and they join. Yeah. Yes.
What was one of the worst cases that you covered?
Worst cases, oh my gosh, there's so many of those too. Like just recently, unfortunately, we had a patient that passed away, severe liver cirrhosis. And we tried, and he was morbidly obese, in a ton of pain, such a hard sight to see. It was very complex client, and we tried to get him resources, put him on certain medications, get him the help that he needs, but he continued to consume alcohol on a daily basis. We couldn't help him. He didn't want to go to rehab. It was destroying his marriage, destroying his children. And I was there in the center of everything. Kids, wife, home health aides, all talking. And what do we do? How do we help this patient? We tried our best, but he essentially passed away because like he couldn't, some patients, no matter sometimes what we do, it's like they have to make that decision to be healthy too, even if we provide all the resources. Sometimes it is our fault to give you humility. We're not always perfect, but we do expect patients to advocate for themselves as well, right? That is important. Yeah.
So obviously you can't control your patient's home environment.
Yes.
So has there ever been a time you had to refuse care because it was almost impossible within their home, like chaos?
Oh, refusing their care. So far I've never refused someone's care before. There was only one time, no, there was like 2 times I had to discharge someone out of the practice because they weren't following like the rules of the practice. I'm like, I have to see you to check in. They were on a prescription for Adderall, for ADHD. And I'm like, I got to see you, I got to check your blood pressure. We got to do your labs. Let me look at you properly and check your heart. And they were like, trying to they didn't want to make the time to see me. I'm coming to you. Like, I'm making this easy for your life. Let me come to you so I can check you up properly. This is your safety, number 1. And 2, it's my liability. Like, I need to see you. And he wasn't complying. I'm like, I'm not prescribing this anymore to you. And we're going to send you a formal letter. You can find other care elsewhere. Here are some places, but unfortunately I can't see you because you're not following the protocol. So that was a discharge of a patient. But like going to a home, oh my gosh, I see from the cleanest, immaculate homes to the most terrible like environments. But that wouldn't deter me from seeing someone. That actually tells me that their environment is so chaotic that that's what's causing a part of their depression and anxiety. So now literally a part of my treatment plan, sometimes I'll add some medication, I'll add a medication, we'll do some counseling. I'll say, clean up the house. So literally clean up the house. Because if they clean up the house and organize, that'll like reduce their anxiety. So I'm like, I'll tell them like, take this cupboard and clean that out. So like, yeah, sometimes we're patients with like lots of pets and like the place is like, and they have a lot of allergies. Oh my gosh, it can be really chaotic. But that's good. That's good for me to see that. So that won't deter me. Does that answer?
Yeah.
Okay. Yeah. Clean up the house. Yes. Yeah. When we're here. Oh, yes. Who?
Yeah.
Oh, yes, you. Yeah.
Okay, so you said for your doctorate project, are you doing stuff with
Cognitive impairment.
yeah, stuff like that? Do you in your practice deal with kids or even adults with disabilities like autism or Downs? And do you like have a specialty for that, or do you refer them to somebody else to get the treatment that they need?
Good question. So no, we're not specialty providers in autism and Down syndrome. So while we stay as the GP, I have a Down syndrome patient and we stay as the GP to manage like, strep throat, he has a cough, whatever. We're the GP behind like other issues, but the actual Down syndrome problem, no, he has specialists and resources that we bring in for him or things like that. So it's a team effort with those things, definitely team effort. Yeah, and cognitive impairments, the doctorate is focused on Alzheimer's and other types of dementia. So it's focused on 65 and above. Huge problem in our society. 1 in 3 patients will have some sort of cognitive issue.
Question about your patients. Are they only located here in Palm Beach? Where's the furthest patient that you have?
Palm Beach County and Broward County. Yeah, so we travel. I could expand, but like I don't want to, and I live in Palm Beach County. I don't want to drive to like Miami. But if we get bigger, if it happens and I hire on another provider, yeah, maybe I'll tell them to take different areas. But for now, no. Yeah.
When you were talking about the home environment, we talk a lot in my classes about scene safety and taking care of ourselves. How do you maintain your own safety? Going into someone's home is always a threat, and being a female and seeing a new patient, you don't know what you're walking into. Are you going in alone? Or
Oh my gosh, that's so good. Oh my God, you need to talk to my husband. He's like, I can't believe, and my mother, like, they're like, they don't like that aspect at all. So, how I do it, well, first off, my husband and my family has like on the iPhone, well, thank God for technology. they can like see where I am. Like, what's the program on the iPhone? Like they can
Find
find,
friends or like 360,
find iFriends,
right?
whatever. So they like see exactly where I am. So that's one thing. I know that's not as like proactive, but it's something. And then before I see each patient, I actually do talk to them on phone and I get to know them a little bit. Like because I have a lot of experience with people and patients on a phone call, a lot of times I can tell where their state is at. And sometimes I'll even do like a little social media search. I'll like kind of look them up on LinkedIn. I'll like see patients are required to submit their ID before I see them, their medical history before I see them. I talk to them. So I try to put these things in place to understand the patient a little bit before I walk in there not knowing anything. Family has the app, and someone told me about a ring that has spikes or something, but no, this ring doesn't have spikes. It's like, you know, there's things.
Yeah.
There's like things with a pen and like these all sorts of things. I don't have that. I mean, I have a little pepper spray, but I forget it. I don't have it. That's a good question.
Thank you.
Where do you see yourself in 5 years with the practice growing, that you mentioned?
Yes, tremendous growth. We're actually going to be leasing on a space. So like once I have an actual practice space, right now we're trying to have an office. So once I have the office, then I could do more stuff. I could implement more things into the practice. Yeah, I do see more growth, more patients, hiring on another provider. I won't be able to take it all to give the proper quality I want to. So more staff, the actual office space, more patients, and actually become a full wellness like approach. Because right now we're family medicine, but I want to implement other aspects like mental health, acupuncturist, like just different things, like maybe implement a little IV fluids into certain conditions. Like, you know, the world is demanding an alternative style of care, not the traditional old school method. So I want to be there, understanding alternative, but sticking to traditional because traditional is still very important. And you apply an Eastern and a Western approach. So hopefully, because we're called 365 Wellness, there's a reason I named it that, because eventually I wanted to convert it to family medicine and other approaches into it within my scope and safely, and not, you know, all over the place, you know, based on evidence-based medicine, guys. Okay, let's like put that there. Yeah.
How do you choose your primary physician?
Oh, I don't have one. I know I don't have one. It's terrible. And you'll ask a lot of practitioners, physicians, if they have a PCP, and a lot of them I think will tell you no. So I have a specialist for a certain issue that I have. So I have that. So I'll ask her to like maybe run some other levels that are general medicine. I know that's embarrassing. Yes.
What advice can you give to the students in here who are maybe considering going into family medicine as opposed to a specialty? Like what, I guess, advice can you say, like if you have this desire, then maybe specialize or perhaps go into family practice?
Oh, hard to answer. I think it'll depend on what you love. Like for instance, I'm just gonna pick on somebody. You over here. The glasses. Yes.
Okay.
What do you love? What do you love to see and do in terms of medicine? What do you think it is?
I think just the aspect of helping people is just, I mean, that's
Helping
my
people overall.
Yeah.
But not like you haven't thought of like what you would love. So I think like for you, not sure. Yes, you want to be in medicine, but not sure. Then, well, you would shadow with someone. That would be the best thing. I welcome if you guys want to shadow me. At one point, you can contact me on our business line. I do have a lot of students. I'm very strict instructor in a way. So bear with that, heads up. And but like, yeah, if you want to shadow and see what it's like in family medicine, you can. And if you know people like that are in specialties, maybe family members, then yeah, shadow them. I think that's the only way you're going to decide what is it that you love. I think I can't advise it any way else. It depends on you and your background, and you know. So yeah. But
What do you look for in someone if you hire them?
Authenticity, genuineness. Of course, if they have those things, automatically they have a good, compassionate personality, detail oriented, they're focused, they can complete tasks. They just appear to have good work ethic. I review their resume. I do look at them on social media. I see if I can find them on LinkedIn. I think the baseline is that if I can tell that an employee cares about what they're doing, that's the foundation. I can take you and now we can do many things with that. That is the baseline though. You have to care about what you're doing. And people can tell if you care about what you're doing. You show the passion for it. First advice.
Any more questions?
Yes.
Yes.
You mentioned your mission trip in Guatemala.
Mhm.
Like, what did you learn over there that you still apply today?
I learned that we need to understand the patient's social determinants of health. And what that means is understanding their background, their financial resources, background meaning family, where they're from, their environment. It made me focus on the fact that not all patients are the same. Like, we need to understand where they're coming from to provide the best treatment. These poor women had no access. No access to finances. How do we now provide the care with them having no resources? We can't be with their like prescription, write up all this stuff and not connect to people and what they have going on. We need to know where people are coming from to diagnose and treat better. I think that was definitely like an eye-opening experience in my 20s when I'm coming from a background who's underexposed to like what people deal with. I was like, this is how people live. This is so hard. Like, we need to have compassion and understand this and not just write them off and listen to them for 5 minutes and give them unreasonable expectations and unrealistic treatment plans. Good question.
Any last questions? No? Well, you guys have been awesome.
Oh my gosh,
awesome
great.
listeners. These have been some great questions. Let's get kind of big.